teachers manage the emotional and academic needs of 30 students at once. In reality, that burden often follows them home to a desk like this. The human mind has strict limits, and right now, educator burnout is reaching critical levels. It manifests as a deep exhaustion that sleep doesn't fix, followed by a state of emotional numbness. These internal feelings lead to behavioral changes. Teachers find themselves with a shorter fuse than usual and a heavy, sinking dread every time Monday morning rolls around. Society treats teachers as an infinite resource for student care, yet we rarely ask, who is supposed to take care of the teacher? Individual exhaustion scales up quickly, creating a massive financial impact on the entire education system. This chart tracks the financial cost. U.S. school districts lose billions of dollars every year. The red indicators show exactly where that money bleeds out: the exorbitant costs of high teacher turnover and the constant need for emergency substitute staffing. The multi-billion-dollar cost of turnover and staffing shortages is the direct result of a system failing to support educator well-being. MentalSpace School operates on a clear principle. School mental health programs should serve the staff as well as the students. The logic is straightforward. Providing teachers with professional support results in better instruction and more stable classrooms. This diagram illustrates the 3 pillars of the staff wellness program: stress management workshops, structured peer support groups, and direct professional consultation. These programs transfer the burden of mental health maintenance from the isolated individual to a formalized institutional support system. When a teacher is left to manage complex student behavioral issues alone, the daily routine becomes an exercise in survival. MentalSpace addresses this by assigning a dedicated team of licensed therapists directly to a partner school, ensuring the faculty is never working in a vacuum. The operational shift is immediate. That teacher now has same-day access to teletherapy and organized peer support, available at the moment of need. The environment moves away from a state of constant exhaustion and into a collaborative ecosystem. Consistent on-the-ground support provides the structural stability required to maintain staffing levels in high-pressure school districts. Emotional support programs are only effective if logistical barriers and high costs are removed for educators and families. MentalSpace maintains full HIPAA and FERPA compliance to ensure that all personal and student data remains secure within the school system. This funnel illustrates the access model. MentalSpace accepts major insurance providers, including Blue Cross Blue Shield, Cigna, and Aetna. The integration also includes Medicaid, which covers the full cost of care and results in $0 copays for participating families. By removing these financial barriers, mental health care becomes a standard, accessible part of the school's infrastructure. Zoom out to the legislative level. State governments are now mandating crisis intervention and violence prevention as part of school safety protocols. Georgia's HB 268 is a primary example. By July 2026, every school in the state must implement behavioral threat assessment teams. While the legislation sets a goal, true violence prevention is impossible to execute if the educators tasked with it are already running on empty. MentalSpace School bridges the gap between policy compliance and community safety by stabilizing the staff first. Fixing the educational environment starts with supporting the people who lead it, giving them the daily strength to guide their classrooms. Higher teacher retention leads to more stable classrooms, which correlates with improved social and academic outcomes for students. Providing teachers with professional support ensures they have capacity to meet the needs of their students. School administrators can visit MentalSpaceSchool.com to integrate comprehensive mental health support into their own districts.